Welcome to the Resiliency of the Human Spirit podcast, where we share all about human triumphs for the collective's healing and empowerment. I am your host, Priscilla Hanley. My guest today is Dr. Paula Rochelle. Dr. Paula is a triple board certified naturopathic endocrinologist and naturopathic neurologist. She has been in practice since 1997. She worked with a medical laboratory studying neurotransmitters in the brains of children adopted from third world countries, trying to help them heal from trauma. In 2006, Dr. Paula crashed an airplane and physically walked away from it. However, nothing prepared her for the emotional trauma she would experience. Today, she is healed and is committed to healing others. Without further ado, I'm going to bring Dr. Paula on right now. Hi, Dr. Paula.
Hello, Priscilla. How are you?
I'm good.
It's an honor to be a part of this. Thank you so much.
Oh, no, I have to thank you. So I'm so excited to connect with you today because you are doing such fascinating work. And I would like to touch on the work that you're doing for the collective a little bit later on. But for now, I would like to get started by having you share your personal journey with our audience on the events that transpired in your life to lead you to where you are today.
Very good. Well, there are many events, but probably the most significant event in 2006, I crashed an airplane and I walked away from that. And, when you crash airplanes, not too many people do that and survive. And it really refocused me. And it was like I was left here with purpose and intention. And I need to get really, really laser focused at what I'm doing. So at the time, I was working with children who had been adopted from third world countries. They'd all been traumatized in various ways. Most of these children came out of orphanages from Russia and Romania. And in the Romanian orphanages, there were 300,000 children that were put in orphanages. 15,000 of those actually died. And if you can imagine, all of these children lined up in these facilities and no one's coming. They're very quiet. You would think that you would hear a lot of crying and stuff, but there's no crying because no one's coming. No one's coming to soothe you. No one's coming to hold you. So these children were adopted into the United States. And many of them had not only, huge emotional traumas, but also physical trauma. Many of them had been abused and, they had parasites and gut disorders and you name it. And the goal was to see how many of those that we could actually help and, get to the point where they lead productive lives.
Wow. So tell me a little bit more about you crashing the airplane. Like, what happened next after you crashed the airplane? That's so scary. You walked away, and what happened?
Well, I was raised in the country and I was always told that you get back on the horse when you fall off. So I did that actually and went back and continued to fly. I was a student at the time and I lost an engine on a single engine plane. I didn't have very many tools in my toolbox at the time. So you just do what you can do. But NTSB actually made me promise I would go back and finish. I went to the hospital that night. I was bleeding profusely. And 4.5 hours later, they found no broken bones. I was still bleeding profusely, and they couldn't get an IV in me. I was too dehydrated. And I looked at the emergency room doctor and I said, if you don't mind, give me the piece of paper. I'm going home so I can take care of myself. And he looked at me kind of funny. He says, no, we need to keep you. And I said, no, you want blood and urine. And I don't have any to give you, quite honestly. And you've offered me no anti-inflammatories. You've offered me, no hydration, nothing. And so I'm going home. So that's what I did. I went home. I never turned around. And that was a Friday afternoon. Monday morning, with my head bandaged up, I had a woman in my office who was returning. She had had a breast removed due to cancer, and we were trying to save the other one. And it was her retest. And I said, no, no, I have to be there for her. And I was. And I had this little angel she bought me that day. And she said, you need a doctor worse than I do. But I never looked back. And I realized that if I was ever going to make a difference, I needed to really understand the brain because while I was walking and talking fine that day, I realized that I had a significant amount of trauma physically in the brain that nobody recognized. I mean, nobody even talked about. And even more than that, there was the emotional aspect of it. No one ever discussed with me what my feelings were going to be after that crash. It was mine to explore myself. And I thought, wow, people need to really understand what happens to them and the fact that they can heal.
Right. So when you said you realized you had a lot of trauma in your brain, how did you realize that?
Well, initially, every time I would put my foot on the floor to try and get out of bed, the room would spin. And I'm like, this is neuroinflammation. Okay. And I was having difficulty focusing. I had a significant amount of difficulty finding my words. And about 3 weeks after the crash, I was asked to be a keynote at a conference in Austin, Texas. And the coordinator couldn't believe I showed up. And I said, it won't be my best presentation, but I am here. And it's very frustrating when you know the word and you've said the word a million times, but you can't access it in the brain. It
Mm.
just won't come forth. And sometimes another word comes forth. And it's like, no, no, that's not what I meant. So, those things led me to believe that I was not okay.
So how did you resolve that then? Did it just take time or did you seek treatment?
Oh no, yeah, well, that's another story. But my husband preferred that I not go back to the medical community. So I had to basically take care of myself. And so I came in, I knew what I knew what I knew. I did what I knew. And then I started searching for answers. It's like there has to be something that will allow me 15 to 20 years later to continue to, function. So probably one of the first things I did after I did homeopathy and, all of we actually use tuning forks in my
Mm.
practice to help to re-regulate things. Cranial sacral was a huge impact on me. I didn't know what it was, and I thought it was interesting. I took a class, and a gentleman was a pilot who was teaching it, and he said, I want to pull this energy cyst out of your forehead. And I'm like, what? Because that was foreign to me. It was one of the most painful experiences I had in my healing journey, quite honestly. And then the other thing that I did was I became really close with a lady that owns a company that does brain mapping, QEEG brain mapping and neurofeedback. And so at that time, now brain maps are like $250, but back then they were $2,000. Well, I just didn't happen to have an extra $2,000. So I saved, and I didn't know how else I could get well. So I managed to get a brain map and do neurofeedback, and I really think it saved my brain. That and some tools that I have to regulate the hypothalamus pituitary adrenal axis, to regulate the signaling in the brain to the rest of the body. And then from the emotional aspects, there are a couple of areas in the brain where trauma is stored, and I worked with those as well.
Okay, so let's stay on this topic about trauma and the brain. So what happens to the brain when we go through trauma?
Well, that depends on where you are when the trauma happens. Okay. Because your set of experiences at the moment, everything you've accumulated in this lifetime from, all of your experiences are what is used to interpret that trauma. So, what is trauma for me may not be trauma for you in the same experience. So, that's the first thing. But it starts here in the prefrontal cortex and sends signals to an area in the brain called the amygdala. And the amygdala says, okay, where's the saber-toothed tiger? How am I needing to go into fight or flight? And it does that if there's trauma. And the cool thing about the brain is that the way it functions is the same in trauma. Now, with the set of circumstances is different, but what happens in the brain is the same. So the amygdala is impacted, the hippocampus is impacted, the regulation from the hypothalamus, which is the right to left hemisphere of the brain, And all of those can be impacted, but they occur consistently with anyone who's had trauma, regardless of the type. Now, there are intensities and other factors, but as far as the brain goes, that's what we need to really focus on to help people heal.
So, is there a difference with brain function when we talk about acute trauma versus prolonged trauma?
Yes, and it still affects, the basics are still there. Prolonged trauma causes some of the structures in the brain to actually decrease in volume. And so there's a real physical thing that goes on with advanced trauma. And not only structurally, but then you start to impair things like hormones and thyroid function, gut function. All of those things get involved with chronic trauma, and all of them need to be addressed if in fact you're going to heal.
Right, right. I think in our last conversation, when we connected, we talked about naturopathy. I can't say that word today. I don't know why, but you mentioned that naturopathy can identify a frequency and how many generations that frequency goes back. It can help identify whether it's the frequency signature within this lifetime or another lifetime. So I am
Yes.
really curious about this part of your work. Can you elaborate more for
I'm
us?
happy to. I use a tool, it's called an avatar. It's electrodermal screening. And it basically sends a signature on top of the acupuncture meridians. And everything in the universe has a signature. Everything is unique. Staph vibrates differently than strep. So the way I explain it, if I had two pianos in opposite corners of the room and they were tuned to one another, if I strike middle C on one, it will actually resonate or vibrate on the second one. So what we know is like frequencies vibrate together. So I can send the signature of a frequency up that meridian and listen for it to resonate back. And of course, we can do different depths. In homeopathy, we have X level potencies, C level potencies, LM level potencies that all mean different things. It means the depth or the intensity, if you will, of the frequency. So once we can identify that, if we can neutralize that frequency, if I have a frequency and it's this big and I create basically an anti-noise to cancel out that frequency, it no longer exists in the energetic template. And of course, that filters down into the physiology as well. So what we've been able to do is look at different emotions and say, okay, this emotion exists. Let's say it's anger, okay? And we look at anger and we say, oh my goodness, this is not yours. This is 4 generations back, but you came in with that signature. So let's clear that signature. It's like there's a little deflection in the spirit when it comes in that way. And let's get rid of that deflection so that you can shine brighter.
Wow, so fascinating. So when you talked about electrodermal screening, for
Yes.
those in our audience who don't know what that is, can you explain to us what that is?
Well, I actually have a tool here, and this
Oh,
is a ground. And we use, if you'll just take and feel right in front of your knuckles, there's
okay.
little indentations there. And they're low resistance, so they're high conductivity. So I can actually tap into that energy at that level, okay, and get a reading on my computer screen so that it tells me, and electrodermal screening is both an art and a science. It's only as good as the practitioner's knowledge base. But once you've got the art mastered or the technique mastered, there's virtually, you can find anything. I have people who come to me from all over the world that, the doctors can't seem to locate, isolate. I just had an instance where I had a medical doctor ask me how I knew, how do you know this is what caused this condition? And I said, because the signature is there. And, for mainstream medicine, that's so foreign. But he was fascinated because when he researched it, that signature caused the condition. And he was like, wow, what is this? So I think, Benjamin Franklin said that the frequencies are really the future of medicine. And I think we're there. The world is, our world today, especially here in the United States, is such that we don't know if we're going to have homeopathy in another generation, and so we're looking for ways to see different areas in the world, quite honestly, so it can survive. But in the meantime, we're having to create frequency remedies, so that we can continue to help people.
Yeah, I so love that. And I do agree. I think frequency medicine is the way of the future because we are frequency. We're
Yes,
vibrating all the
absolutely.
time.
Absolutely.
So I want to ask you, what trends are you noticing in your work with patients right now? I mean, encouraging trends, troubling trends, anything that we need to know about?
Well, I think probably the biggest thing that I see in my practice is fear. We're living in a state of constant fear. And I think this happened back when 9/11 happened for the United States. It was the first time that there had ever been that kind of an insult on this land. And so we started to see that. I do some 24-hour circadian testing, hormonal testing mostly, and it took 6 months, and all of a sudden, we started seeing disruptions in, estrogen, testosterone, things like that, universally, not just in New York, but everywhere. And we said, what is this? What the researchers came to is this is the impact that that event had. So I think right now there's a lot of fear, and just calming that fear down and getting people signaling proper, so that if something as simple as dehydration can affect that hypothalamus pituitary adrenal axis, and then the signaling throughout the rest of the body is distorted. So sometimes it's just simple things that we have to do to go, look, I can regulate this with nutritionals, botanicals, homeopathics, frequency medicine, but what is the work that you are doing? And I usually give my clients homework to do, if they really are wanting to heal, because it's not me healing them. It's a communication and getting them to understand they have to do their own work. I can't do that. I can't do it for them. So I think fear from an emotional perspective is the biggest thing. We're seeing, and of course, most of what I do is neurological at this point, because there aren't a lot of people doing neurology at my level. And so a lot of brain trauma, a lot of emotional trauma, a lot of physical brain trauma. I work with a number of veterans that have had blast injuries, things like that. And I work a lot with end stage, the Parkinson's, the cancers, those things that are just, they're devastating. And yet people need to understand that this is a journey they're going through, and they need to clear some of the emotional pieces of this journey if they're going to get well, if that's the direction they're headed. And if not, then it's my job to help them transition through that process.
So you talked about fear. So if I go to you and I have the frequency signature of fear within my body, how do you neutralize that? What frequency do you introduce into my energetic template to neutralize fear?
Well, there's a number of things to do to neutralize that. One of the things that we use is tuning forks. And tuning forks can re-regulate the body. And there are specific frequencies for fear that we can introduce into the body to regulate and eliminate that. And then I have some homeopathics that work well for fear, but at the same time, fear, I was always taught, as false evidence appearing real. And so you have to look at what that situation is. And also, many times people have what's called memory distortion. And with memory distortion, I'm an advocate that I don't think you need to tell your trauma to me. Okay. I have my own. Thank you very much. Okay. But retelling that trauma, number one, rarely is it accurate, because when it's stored in the brain, it's stored in pieces. Okay. It's not stored as one unit memory. The visual portion of that memory occurs in the occiput. The temporal portions of that memory the auditory goes to the temporal, and so forth. And so that has to be recombined. And when you retell it, The longer a period of time from your trauma, there's gaps in your memory, and you may fill that in with other things that are not accurate. So number one, rarely is your trauma memory accurate, and retelling it just entrains it in the brain and makes the story bigger. So if you come to me, that's the first thing I'll say to you is, I don't need to hear your trauma in order to help you. But I am going to give you homework. I'd like to have my people journal. I'd like to have my people sometimes write letters to individuals and keep them for 3 or 4 days and burn them up and release them. So there are a lot of techniques that are available to us to help people with those things.
Something just came to my mind as you were talking. So for me, I personally feel like my memory is changing. And I don't know what it is, but I just don't really have memory, like long-term memory. If I go back into childhood, I can't really recall much. I
Yeah.
don't know why that is. Is
Well,
that an
yeah.
issue that I
No,
should be
there's
worried about?
no, there's not an issue with, and probably not an issue with your memory. I'm not sure, but I doubt that seriously. But what it is disassociation. So if the memory, and I have people who come to me and they'll say, I can't remember from 2 to 5. And I say, well, what do you remember about that? I mean, it's about your circumstances. I mean, if you were living in Africa, if you were living in a war zone, it's different than if, you had both parents and life was cozy. So, can you tell me a little bit about what that looks like to give me a glimmer as to what direction to go? But the brain basically just disassociates those memories because they're too traumatic for you to process. And they're there. And many times they manifest as triggers because even though consciously we don't recall them, your subconscious keeps the score.
Yes.
So I've found that many times people will have triggers. I know I myself, I was married for, 30 some years, and my husband came to me and he said, in March, you are just not happy. I go, what are you talking about? I love the spring of the year. And he said, no, you're not happy. You're grumpy and you're short. And, of course, it was April. So I had to wait a whole year to figure this out. And so the next March, he was right. And so I sat down one day and reflected and said, what is this? Because I had no idea. And what it was the death of my father. But my father died when I was a little girl. And we went to the funeral and we came home. And my great grandmother said, put your big girl panties on and deal with this. This is what life looks like. The rest of your journey is going to look like this. And so, being young, I thought she was right. We never talked about my father. I never cried about my father until I was 21 years old.
Mm.
So, it's all of those suppressed things that even come up. I mean, here I am, I'm almost in my 50s when my husband says this to me, and I'm like, huh? But it was there. And so sometimes uncovering those things and dealing with them is essential too. But I think the body will tell you when it's right to do that.
Yeah, wow, that's so powerful. How do we work or collaborate with our subconscious mind to help to release all these unconscious limiting beliefs or thoughts or emotions?
Well, there are a number of tools. I like lucid dreaming, just helping people be aware, be present, set their intention, if you will, because I think there's a lot of power in that. And just bringing it forth, and it'll come forth in pieces. Usually, it doesn't usually come forth as an entire memory. But what do you have any memory of that? And what's the emotion attached to that memory? Because I'm more interested in clearing the emotion. I believe that everything happens in that space. And so if we can clear the emotion, the physiology will follow it.
Hmm. And now I want to shift a little bit to cancer patients. I know you work with cancer patients. So my question is, what is the root cause of cancer, I guess?
Well, Sloan Kettering many years ago said there's nothing wrong with cancer. We need to learn to raise our vibration so cancer can no longer exist in our bodies. And I think that when you look at, I mean, we can say 70% of breast cancer has a fungal component. We can look at cancer and say it has a parasitic component. We can look at it and say it's driven hormonally by things like herbicides and glyphosate and things like that. But the reality is, our immune system was compromised in some other way most of the time. And maybe, that's the huge emotional component. I look at cancer like a puzzle. It's like a pie with many pieces, and every piece represents a different portion of our life. The emotional piece, I have sat in this chair now for many, many years, and I can tell you, I have never seen a cancer client without seeing anger at some level. And sometimes, and I'm very clear about this. If someone comes into my office and they have cancer, I say, okay, I have a couple of questions. Number one, what is your belief system about this? Because if you believe that I can't help you, I can't help you. Okay. So do you believe that it's possible to get well? And
Mm.
number two, what is it that you have left to do here? Okay. I mean, if all you tell me is, well, I'm just going to go home and sit in my chair, you're not going to survive. Okay. But if they can say, oh, well, I still have this and I have grandkids and I da, 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 da. And I go, okay, I think I can work with you then. So we look at that. So I always give them the anger piece to sort through. Not that I won't assist them, but that's theirs to work on. And then we work layer by layer to figure out what their puzzle is and clear their puzzle, because every puzzle is unique, and raise their vibration. I love working with music. I learned that music was my comfort when I was very, very young. And I think music has a lot of healing potential that people don't access many times, especially classical music. I'm not saying that some of the newer things might not have benefit, but maybe not so much.
Yes, yes. I love music too. Let me ask you this question. Will meditation help? Like, say somebody has cancer, right? And it's one of your patients. Do you send them home and, you know, for their homework, do you ask them to meditate and send love to the cancer cells?
Yes, I actually had a client many, many years ago, and she came in and she had breast cancer, and she was in the hospital. And she shared this with me, and it was really empowering to me. She said, I laid in the hospital. My sister came in and she's crying, and, oh my gosh, I'm going to lose my sister. And she said, I need you to leave. And
Hmm.
she said, I laid there, and I'm old enough that I remember the old Pac Man game. And she said, I laid there and I imagined those Pac Man eating those cancer cells. And she had a form of cancer where they said she would never survive. She is still alive today. But
Nice.
yes, the mind is a powerful tool, and we can use it to help us heal. So again, I think it's all about paying attention to where our vibration is, so that if we can raise it to the point where it no longer exists. I'm seeing right now some terrible, terrible cancers. It's just, and the unfortunate part of them is they may be well one day, and the next day they're stage 4 and are given no hope. And they're being termed turbo cancers, if you will. And it's difficult, but I think we still have some tools. We have some really cool tools to work with cancer. And I'm very fortunate, very blessed to have some friends who do a lot of cancer work outside of this country, and I can access their knowledge and reframe it for my use here. So,
Nice. What is the legacy you would like to leave behind for all of us?
well, I would like to leave the world a better place than I found it. I don't have that many years left. And the work that I do is so amazing. And it's a different perspective. I'm not against mainstream medicine. I worked in mainstream medicine. There's a place for mainstream medicine, but they're no longer taught how to heal people. They're no longer taught how to take care of the body from a physical and mental and spiritual perspective. And I would like to think that the years that I've spent in this chair, I can impart my knowledge to the world to leave it a better place.
I love that.
Thank
And so
you.
now I want to shift to your practice. Talk a little bit more about your practice. I know we've been talking a lot about what you've been doing in your work, but specifically, what is the name of your practice? Where are you located? Where can people find you if they want to connect with you?
Okay. Well, I have three practices. I have one in Grove, Oklahoma, and it's called the Center for Health and Wellness. And I have one in Owasso, Oklahoma, 10 minutes north of Tulsa, that a lot of my long distance clients fly into. And then I have one in Bearville, Arkansas. And that's an interesting one. My colleagues laugh at me and say, why Bearville, Arkansas? And I said, that's where I was led. And we have the most amazing stories that come out of that office. But I work in three offices. I do electrodermal screening. We do cranial sacral. We do brain mapping and neurofeedback. I do a lot of neurological assessment for people that are having challenges with that. And I teach internationally. So this year, I'm scheduled to go to the Philippines in November and teach at the Institute for Naturopathic Medicine. And I'm scheduled to also teach in Dubai yet this year. So we're developing academies throughout the world where we can share the knowledge that we have to keep this going for future generations. I can be reached at, it's Aysana Health. Aysana in Quechuan stands for balance. It's AYSANA health, okay.com. And then the other thing is, towards the end of this year, I'll be releasing a book. It's called The Other Side of Trauma. It deals with the emotional aspects of trauma and how to heal.
Do you have a client success story to share with us? The most profound client success story. What comes to your mind?
Okay. Well, yes, I can share with you. I had a gentleman who came into my office one day and he said, I don't even know why I'm here. He said, even the VA can't help me. And I said, okay, fine. Two things I need to tell you. Number one, I don't want to hear your story. Number two, I don't think it does you or I any good to tell me. And so, it just entrains it in the brain. And he grabbed the edge of my desk and he was about 6 inches from my face. And he says, you will listen to my story. And I go, oh, yes, of course I will. And so he wasn't sleeping. He had had multiple PTSD events in the military and horrific events that I had to listen to. And he wasn't sleeping. From a hormonal perspective, when we go to sleep at night, our serotonin and norepinephrine lower. But if you're in fight or flight, that doesn't happen. And that's one of the reasons people have insomnia. So he had insomnia. He was really worried about his emotional state when he came to me. And I said, okay, I think I can fix this. So we actually started to correct the neurological pathways that had been impacted. So we had not only emotional trauma, but we had physical trauma. Blast injuries affect the entire cortex of the brain, and it's different than working with, say, a car accident where you have an impact. And so I went to work with him. And long story a little short, he got better for me. He is now working every day, happy. I do telemedicine. He's a long distance client. I do telemedicine with him. And he's like, "Well, doc, I'm fine," as I'm taking care of the rest of his family. But he sleeps, he's no longer has the anger issues. And for him, it was life changing. And I have many stories like that. It's such an honor to sit in this chair and be a part of this process. And I'm so thankful. I'm just so thankful that my life took this journey.
And I want to thank you on behalf of the collective for doing this work for us because you're really giving us a new perspective on how we can heal and take our power back.
Most definitely.
So I wanted to ask you, I know you see a lot of patients, and I guess sometimes that might be tiring for you, emotionally tiring. How do you take care of yourself?
I don't know. I was told once by one of my mentors, find what you love to do and it's never a job. And so, yeah, I do get physically tired sometimes, but I've got a pretty strong constitution and I have a wonderful support system. And I am married to someone who does cranial sacral, so I'm a little spoiled. And,
Nice.
so I try and take care of myself in the ways that I know is best.
So you talked about craniosacral. I am curious about that. What is that actually? What does that do?
The cranial rhythm is the first rhythm of the body, and it's the last rhythm of the body. And it's about a 3 second. And you can actually put your hands on someone and feel that rhythm. It's very subtle. And sometimes the cerebral spinal fluid is not flowing in the brain. And so we can correct that. My husband's actually, and I have been trained at a different level to work with brain trauma with the brain. So sometimes just with gentle touch and intention, we can regulate, say, the lymphatic or glymphatic system of the brain when it's not flowing, regulate the CSF. Sometimes the brain stem is twisted and we'll untwist the brain stem. And with a lot of pain clients, there's from C2 up here all the way down to the sacrum, S2, there's 3 layers of tissue that wrap around the spinal cord. And it's like taking many times with trauma a dishcloth and just twisting and twisting and twisting. And you'll go in and someone will say, oh, well, you have a bulging disc. Well, if you keep doing this, something's got to give, and it's usually the disc. But we can, with gentle touch, actually allow the body to release that. We are just, craniosacral is just a facilitation. We don't push and shove. Sometimes you need vertebrae put back in. We're not your person. But sometimes we can take and allow those muscles and ligaments to relax, and the vertebrae will come back by itself.
Mhm.
So it's a different perspective, but it's an amazing tool. It is such a valuable tool to our practice.
Do you teach craniosacral?
I do not teach cranial sacral.
Okay.
The best place to learn cranial sacral would be through Upledger. I believe the website is upledger.com. And Dr. John Upledger, who has passed now, has developed the technique. It's taught worldwide and it's being used more and more, even with mainstream now. So we love it. We like to think that we do some things with it. If you can think of, if you have an impact, you have these cells, they're called glial cells in the brain, and they attach around a neuron and a blood vessel, and they help to get debris out of the brain. So when you get really brain foggy because you didn't sleep last night and you didn't detoxify your brain efficiently. So what happens in an accident is they all bunch up on one another like a train wreck, and
Mhm.
they form what's called a glial scar, and you can release that with cranial sacral. So you can improve that brain flow again.
I was just wondering about your practice. So if I'm in Virginia and if I would like to have a consultation with you, do I have to fly into Oklahoma or can you do it like on
Absolutely
Zoom?
not. No, I have many, many long distance clients teaching globally. You acquire clients all over the world. So
Right.
I have clients from the Philippines, I have clients from the UK, and we just set a telemedicine appointment. I require you to fill my paperwork out in advance. And we schedule an appointment time and we get on. It's actually not Zoom. I use a secure medical server to interact with you. And all you have to do is click the button and it puts you in my waiting room and I connect the call and you can actually watch me test. I have you send a saliva. During COVID, we sent hair samples. It doesn't matter, whatever it is, the entire signature of the body is retained within all of that. So we can actually test that to see what's going on.
So from the saliva test, you can get the frequency signature of the person, correct?
Of the entire body. Yes,
Wow, that's so
absolutely.
fascinating.
Yeah. Then I basically use myself as a surrogate to test with. So it works out really well. But you can actually see my testing online. So it's nice and we can interact and have questions. And yeah, I enjoy my telemedicine work a great deal.
Do you have Facebook and social media presence?
I do. My Facebook is just Paula Rochelle. And then there's Dr. Rochelle Center for Health and Wellness is my business Facebook, which would probably be the best one to connect with.
Okay.
But yes, I do. Not great. I'm not good with all of this technology. I tend to be more energetically inclined. So it's sometimes I sit here and go, okay, please work. And sometimes it works. But anyway, I do have a team of people now that are working to enhance that. But my website has all of the information of all of our modalities. We also do neuro-emotional technique. I have a practitioner that's certified in neuroemotional technique, and she uses muscle testing and homeopathy to clear emotions, and that's very effective as well.
We have like 5 minutes left, Dr. Paula, so I'm gonna ask you my signature closing question that I ask all my guests. So here is my final question for you. What is your closing message for humanity to help in our collective healing and empowerment?
That's easy. I just want to leave the message that you can heal. Okay? People are so broken in this world today. And I think that we send that message through the medicines we take, the social interaction that we have. Everyone is like, well, what doctor are you seeing and what medication are you taking? And we need to shift that vibration and into a healing space because if we don't, the universe won't survive it. And so I just want to explain to people and let them know that you can get better, you can heal, and life is good. We are not meant to be unhappy in this lifetime. We're meant to serve, but we're not meant to be unhappy doing it either.
Oh, I love that. Thank you so much, Dr. Paula, for being here
Thank you.
today. No, thank you. You're doing such profound, fascinating work, and I am so thankful to the universe for bringing us together.
Yes, I as well, even though it was challenging.
Yeah, it's okay, but we made it happen, right?
We did. We
Yeah.
did.
So, for everybody who's watching and listening, thank you for your time. And until next time, bye for now.